Mic check.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's Postgraduate course which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Good evening, everyone. Thank you for being here tonight. Our program will begin in 15 minutes. Please take this time to prepare and secure your seats as we will begin in 15 minutes. Thank you.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinumed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Hello?
Hello. Good evening, everyone. We are delighted to welcome you all as we come together to deepen our understanding and skills in managing these timely veterinary health issues.
Hello, everyone, and great evening. Thank you for your unwavering dedication to the welfare of our beloved pets. Let's look forward to a session filled with valuable insights and learning.
Welcome to this momentous occasion. Shortly, we will be privileged to hear an enlightening lecture from our esteemed speaker.
Our speaker for tonight will be discussing the 8 urinary issues every veterinarian should recognize in companion animals. Of course, this event would not be possible without the support of our partner company, AOZI. They have booth outside. Please feel free to visit them later.
Okay, so please join us in a warm round of applause to Mr. Dave Chua, owner and CEO of AOZI, along with his dedicated team. So for Team AOZI,
Thank you, AOZI.
thank you so much. Please, let's give them a better round of applause, please.
Yes.
Thank you.
Ikaw.
Later this evening, we will also hold the 2025 conferment ceremony of the Philippine College of Canine Practitioners. We are proud to welcome 8 distinguished individuals here tonight as we honor them with their well-deserved recognition as new fellows and diplomates in the veterinary practice.
Held here at the elegant Luxent Hotel in Quezon City. Tonight, we celebrate excellence, dedication, and pursuit of veterinary distinction.
I am Dr. Gino Bailon, and it is my great honor to serve as one of your masters of ceremony this evening.
And I am Dr. May Christine Ablaneda Espiritu. Together, we will guide you through tonight's meaningful and inspiring program.
To officially commence our event, let us begin with a special presentation from our partner, AOZI, represented tonight by Pure Natural Organic Pet Food.
Thank you so much, AOZI, for being our partner in advancing veterinary services. Up next is an insightful scientific presentation entitled 8 Urinary Issues Every Veterinarian Should Recognize in Companion Animals. To introduce our speaker formally, I would like to turn over this honor to Dr. Gino.
Thank you, Doc. Thank you, Doc May. Tonight's speaker is a distinguished veterinarian, a graduate of the University of the Philippines, Los Baños in 2009. She has received several honors, including the Golden Dragon Award of Excellence and the University of the Philippines Alumni Leadership Award. Specializing in small animal medicine, she has trained in the US and Thailand and actively updates her knowledge through international seminars. She is the owner of Doc Aline's Veterinary Clinic and Grooming Center, co-owner of 5-Star Pet Clinic, and has served as a technical consultant for Zoetis Philippines. She is also a diplomate of the Philippine College of Canine Practitioners, a diplomate of the Philippine College of Veterinary Surgeons, Companion Animal. It is a true privilege to have her share her expertise with us tonight. Please join us in giving a warm welcome to Dr. Sherlyn Gamboa Subiaga-De Lima.
Thank you, Doc Gino. Thank you, Doc May. Good evening, everyone. Okay, so for tonight, I will be discussing about 8 urinary issues every veterinarian should recognize in companion animals. So I want this informative lecture to be some sort of interactive. So I'll be giving some type of quizzes along the way. And as I think AOZI will be having some sort of prizes kung meron pong all correct dito sa mga quiz ko. Okay, so I'm Doc Aline, and I am the owner of Doc Aline's Veterinary Clinic and Grooming Center, and also 5-Star Pet Clinic, part-time owner in Santa Rosa. So, 8 urinary issues. These are very rampant nowadays, right? But the question is, why? Dear doctors, ano yung primary reason why urinary issues are rampant, not only in small animals, but also in us, humans? What do you think? Diet? Yes, I hear it correctly. What else? Yes, Doc. Lifestyle. Very good. Sino pa po? Yung pinaka number 1, genes. And also, what else? Actually, may 4 eh. Okay, yung first one, it is because of infections. So usually urinary tract diseases comes from staphylococcal infection, streptococcal infection, Klebsiella. So it comes mainly because of urinary tract infection. And I will deeply dive deep into it later kasi marami siyang types. Sometimes we forget ano yung mga types of UTI. So right now, it will become some sort of review. The other one is structural problem. Most of the time, we think bacterial infection, kaya meron tayong UTI. But otherwise, meron din tayong tinatawag na enlarged prostate. Diba? That's the reason why hindi rin makaihi ng maayos because there's a structural obstruction dun sa areas po ng prostate. Usually sa tao, it's more of pregnancy. Diba? Nagkakaroon ng uncontrolled or involuntary movement ng ating urination, pero ganun din sa dogs and sa cats. And structural, it also because of kidney stones, right? The next one is nerve damage. I had one patient na medyo gulong-gulo na ako, hindi ko na siya matulungan kasi na urinary culture ko na siya, na-assess ko na lahat urinalysis, pabalik-balik na. Pero hindi ko malaman paano siya masosolve. So, I had one mentor in Texas that had the same problem, and it boils down that it was actually not infection, it was not because of structural problem, but it was actually because of nerve damage. There was a spinal cord damage pala, kaya kahit anong gawin ko, i-treat ko na siya, hindi pa rin siya gumagaling. So as veterinarians, it is a must to also conduct additional tests. So I'm very happy to know that Doc Mary Ann, hi Doc, sa PFAC, she has all the resources that we need. Meron tayong CT scan, may MRI, and also she has dialysis. So you just talk to her if ever we'll be needing some dun sa mga clients natin. And ito na, very good si Doc. Si Doc ang nagsabi ng lifestyle. So most of the time, it's because of the way the pet owners feed their dogs or their cats. Marami pa po ba, dear doctors, na mga clients that feed human food? Sino po dito yung nakaka-encounter? Kasi in my clinic, because we're in the province, so most of the time, human food. Hindi pa masyadong accustomed into giving cat food or, dog food. Then also, the reason is because they do not drink enough water. Even if we give them proper medications, the problem boils down to water therapy. I'll be giving or sharing to you a table later what or how many liters or ml of water does a pet need a day. And also, diabetes. Do not forget to always perform blood chemistry panels when dealing with urinary tract infections, because sometimes we thought we're doing the best we can, but if we do not, analyze fully the blood chemistry panels, amyloid count because of, the pancreatitis itself. So it's very important also to perform blood chem. If ever, dear doctors, you're dealing with urinary tract infections, how often do you actually perform CBC and blood chem? Do you do it every 5 days, Doc, for the CBC? Yes, Doc. So si Doc is every 5 days for blood chem. Ano yun po yung consensus nyo? In my practice, I do it at the very onset of the problem, and then I repeat it after 1 week, okay, if they have the budget. And for the blood chem, I repeat it after 15 days. So I will be comparing, okay, ma'am, sir, I want you to perform CBC and blood chem, and then we repeat it after a week. Since we already gave the medications, if it's not working, then we proceed with continuation, but tinataas ko na yung type of antibiotics, okay? So we're now going dun sa 8 urinary tract infection. The first one, I gave lang yung mga possible reasons bakit sila rampant. So now, let's move on to the urinary tract infection. Okay, ito na yung quiz. Ayan. So, true or false? A urinary tract infection affects only one component of a dog's urinary system. Okay, may false dito. Dito po kaya? False. Okay, tingnan natin. Tara! Yes, it's false. So, palakpakan nyo naman kasi talagang lang to, review siya, pero nakakalimutan natin. Diba? Sometimes, pag nagpe-present yung client, iniisip natin na galing lang sa baba. Right? Vaginal, o kaya naman sa penis, diba? Doon nagsisimula. But, we have to bear in mind that urinary tract infection affects one or more components of the urinary tract system. Hindi lang galing sa labas. It comes from the kidneys, going to their, ureter, the tube that connects the kidney to the bladder itself, where we remove mostly the stones, and the urethra, kung lalaki. Then, second question. Dapat may maka-perfect. Okay, true or false? Typically, UTIs develop from harmful bacteria from the genitourinary tract. May false? May true. Okay. Parang gutom na ba kayo? Malapit na tayong kumain. Okay, this one is false. Okay. Typically, UTIs develop due to harmful bacteria but it's more of either from the skin, okay? It's not just because of the urinary tract infection. So during college days, they always tell me it's an ascending infection most of the time. So kung may problem sa skin, may problem sa GI tract, pwede siyang mag-enter dun sa urethra. So kaya ang nangyayari, yun yung urine hindi na rin nakakalabas dun sa katawan. Kaya po kung meron tayong demodicosis cases, kung meron tayong scabies, sometimes they lead also to UTI. Meron na po ba kayong nagkaroon din ng UTI na may mga problems sa skin? Or wala pa po kayo nako-correlate? Actually, this one, maganda siyang gawing thesis. Yung may mga problems sa skin, usually po, nagkakaroon din po ako ng urinary tract infection ng mga clients ko. Third question. So, the bacteria will then invade many of the urinary tract defenses and make its way to the bladder. True or false? True. Tingnan natin. Yes. So, the bacteria will continue to grow. Kung nanggaling man siya sa GI tract, nanggaling siya sa skin, it will multiply and it will spread until we veterinarians will administer the proper treatment. Next, UTI can be classified into uncomplicated, complicated, and recurrent. True or false? True, yeah. So I have here one patient. So this is Kelly. The chief complaint of Kelly was difficulty urinating. So this one is a classification of uncomplicated UTI. Why? Because it's just a sporadic bacterial cystitis, nagkaroon ng gas-gas yung kanyang bladder, and found siya sa apparently healthy animals. Hindi siya komplikado. Mabilis lang natin siyang matulungan. Kasi meron siyang normal urinary tract anatomy, wala siyang structural problem, meron siyang functional na bladder. So this case, number 2, is about lilac. So we're already seen naman dito yung kanyang bladder stones. And this is actually a complicated UTI. So when we say complicated, it actually occurs in a patient with, yes, it could be functional or there's no anatomic abnormalities in the urinary tract, or in patients actually with risk factors. So when we say risk factors, meron siyang possible na persistent, paulit-ulit, or pabalik-balik na infection, as well as yung sometimes, ano po ba yung napupunan nyo? Nagkakaroon ng treatment failure. Ano po yung one reason kung bakit nag-fail yung treatment? Ano, Doc? Clients. Anong nangyari? Compliance. Yes. Actually, yes. I've seen it for 14 years already. 14 years na po ako nagpa-practice. And hindi siya because of us. Sometimes they do second opinion, third opinion, and then it boils down to, pagdating sa akin, ma'am, tinapos niyo po ba yung gamutan from first vet? No. So the problem, kaya nagkakaroon na ng complicated urinary tract infection is because the client itself does not have money, diba, to complete all the medications given. Then this one, recurring. Pabalik-balik na siya. So you have to do cystosynthesis. So this one is Tiffany, on and off na yung oliguria. Kaya kailangan na muna for the meantime mag-perform ng cysto bago kailangan siya i-catheter or bigyan na po ng surgical intervention. So for recurring UTI, ibig sabihin lang, bumalik. Okay. Then the second one, so yung isa is UTI. This one, paakyat na tayo. The second urinary issue is about urinary bladder infection. So this one, we can see here the ultrasound, bladder and with the thickened walls. So meron na siyang inflammation ng bladder called cystitis. Pababa, we have flute D, alright? For cats, it's the lower urinary tract diseases. So this one is a Shana, oliguria yung case niya. So pag sinabi kasi nating lower urinary tract disease, it is a general term. So para siya sa kahalahatan ng urinary tract diseases, but it actually describes multiple problems of the bladder and or the urethra. Kaya yung iba, sabihin, Doc, kinatiter na. Pero hindi pa rin nag-improve. Why? Because the veterinarian was able to perform, catheterization, but was not able to check out other problems aside from the main issue. So it was our job as practitioners to always make sure, have we gone deep down? Did we perform the best we can? So yun po yung laging, every day when we wake up, we have patients. Let's ask ourselves, nagawa ko na ba lahat? Okay? Na-introduce ko na ba itong mga kailangan malaman ng clients or ma-perform? So the next one is very exciting. Actually, katatanggal ko lang ng bato kahapon ng Darna. So it's the urinary bladder stone. So we perform usually cystotomy. And we had attended another lecture last month about it's about Doc Marcos' case. Pag-name actually nung stones. No? So, i-analyze yung stone. Hindi tayo titigil just by merely looking at it. We say it's struvite, calcium oxalate, but actually, putting it in the laboratory so they can analyze the stones for us. So, what's the importance of that? The importance is because, number one, we already know that the pets will be stone former, right? And so we will be able to tell our clients what type of diet does the dog or cat needs, right? So that's the importance of that. And this one, sino na po ang nakaranas ng urinary bladder cancer treatment? Doc, meron na? How often mo na-encounter, Doc JM? Very minimal. So, nalimutan ko na actually to. Okay, yung urinary bladder until such time na naka-encounter ako. It's called TCC, right? Transitional cell carcinoma. It is actually an unpleasant malignant tumor of the transitional epithelial cell lining of the urinary bladder. So, during surgical intervention, laging sinasabi nung mentor ko sa college, sabi nila, wag masyado problema sa the way you stitch the bladder. Sabi ko, Doc, why? It's because the bladder has self-healing properties. So, very flexible, mabilis siyang maghilom. Ano po bang madalas yung gamiting suture patterns? Do you do continuous, simple, interrupted? Did you do the inverting na suture? Okay. Yun, pareho kami ni Doc. So, usually, yun yung palatandaan. However, because of that characteristics of the bladder, it actually made the bladder more vulnerable to having the TCC, transitional cell, epithelial cell carcinoma. So, there is a test that we do in Texas when I did the specialization there. It's called the BRAF mutation test. And I haven't been able to ask around if we have it here. Do we have po ba BRAF in Singapore, Doc? Wala. So it's a non-invasive test for the cancer. And it turns out actually that 85% of canine TCC have specific mutation. So dun siya pala nagkakaroon ng mutation. It's called the gene called BRAF. It can be used to screen apparently normal and at-risk dogs, and medyo marami lang kailangan kunin. It's around 30 cc, and it's not available pa actually for cats. So it's BRAF mutation test. Prognosis, if the dog has TCC or the cancer itself, usually 118 days median survival for dogs with evidence of tumor invasion to other local organs, but 218 days for those that do not have, and 234 days for those with no lymph node involvement, and 70 days with lymph node involvement. Treatment options. So I actually gave partial removal of the bladder to my case. So that's what we agreed upon ng owner. But sometimes others, if it's too large, you have to completely remove the bladder. Complete removal. And also permanent catheterization, but it's very, very taxing because, you know, if it's a cat, they try to wiggle it out, put it out, right? And the urethral stenting because of the stricture or trauma. And I haven't seen laser ablation, but have you done this, Doc Mary Ann? Laser ablation of the bladder? Not yet. Okay. So wala pa din. Pero may chemo din siya. May chemo treatment. For medications, sino po ang fan ng NSAIDs? Raise your hands. Pag nagpe-prescribe, ginagamit siya. Actually, ang pinaka ginagamit talaga is piroxicam, deracoxib, and firocoxib. For chemotherapy, I don't know if yung mictosantrone is available na sa Philippines, but carboplatin, we were able to use it for bones, right? Gemcitabine, hindi ko pa rin po siya nagagamit. Then, okay, malapit na po tayong matapos. We're already on number 6. It's called urinary incontinence. So, ano yung mga possible causes? Actually, number 1 po dito is hormonal imbalance. So, kaya po nagkakaroon ng urinary incontinence because meron tayong possible weak bladder sphincter, urinary tract infection, there's stones, and always remember to always check the spine because affected yung ating pag-urinate. If meron tayong spinal injury, for boys naman or for dogs, prostate disorder, actually po itong lecture na to applies not only sa ating fur babies, but only to us. Also to us, humans, no? So, congenital abnormalities, very prominent din yung urinary incontinence. And if we actually are giving some sort of medications that can lead to urinary tract incontinence or urine leaking, no? So, nagbe-bedwetting. So, yung PPA, so it's phenylpropanolamine, it improves actually sphincter tone. So, nagagamit ko na siya sa clinic. For hormone replacement, I haven't tried this one, but estrogen strengthens the muscle and also the urethra. And GnRH, gonadotropin-releasing hormone, as part of the hormonal therapy for hormone imbalance. And yung last, but before yung huli, it's called kidney failure. So, kung meron po ditong mga co-colleagues po natin na naka-sign up dun sa aking Facebook page, I had one patient, she's Feli at Chow. So, 13 years old na po siya, presented to me as third opinion case. I was able to bring her to life for 15 days. And then, anong pauwi po ako, nawala na rin siya. So, nanonood po yung owner ni Feli, pero it's because of chronic kidney disease. So with kidney diseases, we have to make sure that we tell them also to have their other pets na nabubuhay pa, na ipatest din. Okay, blood chem, CBC, because if they're eating the same type of diet, worst case scenario, itong mga ibang dogs niya, 12 years old, 10 years old, could also have kidney disease, right? And then, this one, hindi masyado natin na diagnose. Kasi it's called the less common urinary tract condition. Meron pong makakahula kung ano yung, medyo marami to eh. Ano kaya itong mga less common urinary tract infection? Sige, Doc. Sige, Gcash ako, 500. O makakaahula ng tama. Less common urinary tract infection. Uy, without Google naman, Doc Randy. O sige, less common, kahit isa lang. Sige, Doc, huwag kayong mahiya. Ano daw? Hindi ko marinig. Sige, Doc, raise your hand. Less common siya. Wala pa. Okay. Sige, ito yung first. Kidney infection, pyelonephritis. Di ba hindi naman siya masyadong ma-diagnose? Kaya mo bang sabihin, oy, hindi yan UTI, pyelonephritis, by just merely looking at it? Hindi, right? You have to dig deeper into the problem. Yung kidney stones, kaya siya less common, hindi mo rin naman siya makikita na i-auscultate mo yan, i-ultrasound mo agad ba? By just, presenting to you the case? Hindi, di ba? So, kidney stone characterized po rin siya as less common. Proteinuria. Kasi, ito yung lagi nating nakakalimutan. Yung pag nagtitingin tayo ng urinalysis, ang main focus ng veterinarian when I was, doing my externship is para malaman kung meron bang possible crystals, right? Pero we do not actually think that the proteinuria is actually a urinary tract problem already. Why? Gaano po ba kalaki yung molecules ng protein? Malaki. So, hindi siya dapat lalabas, right? If this protein actually is nandun sa UA, sa urinalysis natin, ibig sabihin, may problem. So, I was impressed actually with one insurance company when I applied for them. Kasi sabi nila, Doc, hindi na po kayo iba-blood test. I said, why? Para po ma-approve kayo, we just have to perform urinalysis. Oh, that's how powerful actually urinalysis is. So if actually you want to make sure you're okay, wag niyo po siyang tatanggalin sa CBC nyo and blood chem. Kasi di ba tayo, we do it every 6 months, as humans. Lagi nyo pong isasama ang urinalysis. It's very powerful. You can learn a lot based on your, overall health. And also, ito, neurologic condition. Feeling ko meron akong atony. Kasi when I gave birth, di ba, it's more of a physical changes sa katawan ng hayop at ng tao. So sometimes nagkakaroon ka ng atony. And also, strictures, minsan catheter tayo ng catheter. Tapos darating yung point, re-refer ko na po kayo, parang kailangan na po ng penile urethrostomy. Bakit? Kasi nagkaroon na ng trauma. Suksok ng suksok, catheter ng catheter, oh my gulay, nagkaroon na pala ng kalyo. Hindi na maipasok. So yun, lagi po natin siyang i-take into consideration. Also, there are diseases that start also in other body organs. Lagi kong sinasabi, UTI hindi lang siya galing dito sa baba, pataas. Pwede siyang prostate diseases, pyometra in female dogs, Cushing's, diabetes and diabetes mellitus toha, tsaka po diabetes insipidus. So, malapit na mag-end yung aking lecture. As your speaker for tonight, I want each and every one of us to upgrade our practice by always make sure we consider complete blood workup. We can also actually have an algorithm in our own clinics. We want to do it every 3 days, want to do it every week or every 2 weeks. Urinalysis, huwag pong kakalimutan. Marami na po ditong may urinalysis machines. Opo, no? Very, powerful tool yan. Ultrasound, lahat meron na po. Okay, very good. Also, X-ray and urine culture. So, like what we always say to our clients, prevention is better than cure. Okay, so we have also to advocate giving our pets medicated food. So, AOZI actually offers a specific cat food line, AOZI Urinary Care, which is designed to support feline urinary tract health. Sino na po yung meron pong AOZI sa clinic? Okay. Yan. So this one, it includes actually management of the struvite and calcium oxalate stones. And this food line includes features like dissolution of the struvite itself, urine dilution, and lower RSS. So this one is the relative supersaturation. That will help the crystals to prevent crystal formation. Because we do not want naman po our for babies or our patients to be okay with medications, then after we finish the medications, they're back to not being okay again, right? We have to make sure that we give them medicated food because these are, like what I say, let thy food be thy medicine. So, the next one is water therapy. During WASAVA, it was mentioned that this is a powerful medications that veterinarians often forget. Right? Because hindi naman po nire-reseta yung uminom ng tubig. Tama? But I do. Nire-reseta ko siya. So, I have the software. Nakalagay talaga siya dun sa ilalim. Give blank water. Kailangan i-consume siya ni client everyday. So, I have this chart. So, it depends on, ano lang siya, may guide ako sa weight. Ano na lang siya, i-convert nyo na lang po siya sa kilograms. Kasi ito po is pounds. And then, And then, for dogs, we have here how many liters of water does each dog needs. And I want every one of us to also include it in our prescription. That's it for tonight, and I hope I was able to give you a glimpse of urinary practices.
One round of applause to Doc Aline. Thank you, Doc Aline, for the knowledgeable and very insightful lecture. At this point, we now open the floor to entertain a few questions from our attendees before we have our dinner. So, any questions or clarifications from our participants? Doc Randy?
Good evening, Doc. Thank you for the insightful presentation. I just have two questions with regarding, do you recommend doing subcut fluid therapy of NaCl? And also, what is the best urine acidifier you think can be prescribed?
Okay. The first one, Doc, is subcutaneous fluid therapy. So, with regards to fluid therapy, you have to discuss it to your clients. One. Why? Because, Doc Randy, we're talking about bladder and then meron na tayong problem, hindi makaihe. Right? So, ano yung repercussion? Bibigay tayo ng fluids, paano lalabas? Right? Fluid in, fluid out dapat. So, usually, kasabay ko si IV fluids para hindi magkaroon ng hypovolemic shock. Right? Because the body knew already that marami namin siyang laman. And then, ika-catheter mo siya, biglang mawawalan ng laman, doon na mamatay. Right? Sa operating table. Meron na po ba naka-experience? Na-stabilize mo naman siya, pero nag-catheter ka, nag-seizure, na matay because of hypovolemic shock. And also, the other one is septic shock. Gaano na ba kataas yung WBC count? So, with regards dun sa case ni Doc Randy, magpo-fluids ako pag nag-catheter ako. Bakit? Kasi nga, pe-prevent ko yung shock. The next question, Doc, is acidifier. Meron tayong ginagamit na methionine. So, depende po kasi sa brands lang po na preferred natin or available sa clinic. And also, yun nga, kailangan talaga, hindi lang po natin siya ibigay ng 1 week. Actually, matagal na proseso. Matagal na process. In my case, actually, nag-start ako ng 1.5 months. Bago ko siya i-win off sa medications po. Kung i-acidifier ko po siya.
Hi, Doc Aline. My question is, natakal natin kanina yung neurological anomalies dun sa UB. No? What would you suggest or what would be the best line of treatment for that kind of situation?
The cancer? Or the neuro?
Neuro, Doc.
Okay. For neuro, magastos. It's very expensive because from the diagnosis itself, kailangan po nating i-consider what type of damage, what part of spinal po nadadamage? Is it in lumbar part? Okay? Kasi marami naman na tayong advanced po na medications. Actually, hindi oral. Pwede na siya ng laser. Magnetotherapy, Doc. Magnetotherapy. It can actually help na po with stasis and also neuro problems, right? But with regards, Doc, sa katulad natin na, say for example, nasa province, hindi kaya pa ni owners, actually, mag-start po muna tayo ng mga pain medications. Yes, Doc, no? Tapos, sino po dito ang naka-experience na ng therapy using water? Meron ka na, Doc. Yung parang sa tao, it's called swimming. But when we're doing it in Conroe Vet Clinic po, meron po kaming nilalagay na parang planggana. Ilulubog po namin, half body. Tatry po namin siyang like horses. So, water therapy, if it's problem po sa spine, nakaka-help siya. But the thing here is, we were actually using Epsom salt sa maligamgam na tubig. So, pag pinauwi ko yung client and I think hindi pa kaya, ma-refer kay na Doc Chris, yun po muna yung pinapagawa ko. Kalahati, kung dito po yung prob, kalahati nakalubog, kahit sa maliit na batya, maligamgam na tubig, lagyan niyo siyang Epsom salt. Gawin niyo po siya. Kahit po 5 minutes muna. Kayo, yung owner muna yung mag-stimulate. Then, after that, we have also Doc Rochelle Alonte. She's actually performing acupuncture. Kung wala pang budget for laser therapy and magnetotherapy, I think that can help. Sino na po ba nag-acupuncture sa clinics? Wala. Ayun, yan si Doc. Di ba, Doc, meron ka na po no, for structural problems, spinal damage. Pwede rin po siyang makatulong. Pero kung wala pang budget, pain medications. Kung anong available na nagamit na natin and nag-improve.
Okay. We will be entertaining 2 more questions from our attendees. Any questions? Doc Cesar.
Please state your name and affiliation.
I only have one perhaps relevant question. I think all of us would do consider this. How do we encourage like cats to drink more? Kasi this is one problem we often face sa practice. Kasi maganda talagang ma-hydrate sila. So how do we encourage this? Do we have to put them on a treadmill or something like that? So paano po, Doc?
Thank you, Doc Cesar. Actually, that's one good question. Mayroon po kong trick na ginagawa po. No? Yung first one is the catnip. Alam ko matagal na to pero it works. Catnip, gagawin mo silang very high. Diba? Sa cattery nila, akyat pa na og and all. So, para silang naka-high. So, after that, they drink water. Okay? Second, yung catnip. I think meron sa Shopee. Right? Yun. The second, in Timu, I had one patient po, she actually bought yung pong parang fountain na inuman. Kasi once the cat sees something moving, hindi ko po alam yung name, but it works for us, dun sa client ko. Yung ikot-ikot lang yung tubig, drink sila ng drink. Fountain na, Doc, no? Pero parang may filter na din siya, Doc, no? Yun, fountain, itry niyo po siyang ipabili sa cat clients niyo po. Kasi nakaka-help siya. Anything that moves or may color, pwede siyang maka-attract. And also, actually, kakagaling lang po namin, Doc Lina, sa convention. Doc, nakapag-uwi ka ba? Yung parang siyang fishing. Ayun. So, binigyan kami sa Washington nung para siyang pang-fish. Tapos, habulin nung cat. So, nag-work naman siya, Doc, sa cat ko. Umiinom naman siya after that. Pero syempre, tayong owner, yung mag-fish dun sa cat. Meron siyang nakalawit So, yun. Anything po na magagawa ni owner, makakatulong. Kasi kailangan lang po sa cats, I believe it's more of stimulation. Kasi playful sila. And also, yung pang-apat, pag may mga confinement po ako, cube ice cube. Mineral water. Oo. Kasi pag nakita nila na iba-ibang, kasi yung ginagawa po namin ng assistant ko, meron kaming molde na may star, na may heart. Yun yung pinapainom talaga. Kasi malalaman ko na pagaling na kapag nag-start na siyang kainin yung yung ice cube. So nakakatulong po yun. And also, I also give Doc para siyang parang salt block sa horses. Naglalagay yung konting asin. Tapos, di ba, malalasahan nila yung asin. Iinom din sila. Pero syempre, not too much. Salt, ordinary salt po. So, once na-lick nila yon, hanap sila ng water. Pero, nasa owner talaga. Yung owner po, meron din akong cases, nagpapabili ako ng malaking syringe sa mercury. 50 ml ba yun? 30 ml? 10 ganon every day. So, naka 300 ml na si Kat. Pahirapan, kalmutan. Ayun. Pero walang choice, right? So yun po, maraming pwedeng gawin.
Yes. One last question po. If we have, if none, thank you so much. Ay, meron pa. Sorry, Doc.
Dr. Coloy.
Hello, Doctora. My question is, this may be out of your topic. With regards to the urethrostomy, what is the difference between the application of this surgical procedure in cats and in dogs? Do we need to remove any organ with regard to this procedure?
Okay. Doc, with regards to urethrostomy, anatomically, kailangan mo lang mag-create ng kifi. Diba? Yun yung goal. Kailangan lang natin mag-create ng kifi dun sa boys, whether it's a male dog or a male cat. But the thing here is, based on the weight, dun lang nagkakaroon ng difference. Kasi mas mabilis naman talagang i-perform si cat, yung penile urethrostomy in cats, right? Ang problem, I've seen it basically dun sa own pet ko, aso. Usually, naglalast lang po after PU ng 2 months. Why? Because of it's open already, the ascending infection comes in, and most of the time, even if you want them on an e-collar, they tend to lick it. Kasi they're not used naman to having that, na wala silang penis, right? So, in addition to that, syempre, when we do PU, nagkaka-straight. Diba? Nagtatanggal na rin tayo ng kanilang balls. So, sa tingin ko, Doc, anatomically, ang magiging mahirap is more of the dog when we perform surgical intervention. But the main focus is to be able to create an opening where the fluid comes out and wala na tayong obstruction dun sa urethra itself. Yeah.
Thank you so much, Doc Aline. Before we end the lecture, allow us to award this certificate of appreciation to Dr. Sherlyn de Lima.
Yes, may I call on Dr. Joff Carulo to award the certificate of appreciation to Doc Aline. Okay, so let me just read the citation. The Philippine College of Canine Practitioners awards the certificate of appreciation to Dr. Sherlyn Subiaga for her expertise and dedication, invaluable insights into the diagnosis, treatment, and management of 8 urinary issues every veterinarian should recognize in companion animals. Given this 28th of July in the Luxent Hotel, Quezon City, Philippines. Signed, Dr. Joff Marl B. Carulo, President, PCCP. So much, Dr. Aline.
At this point, we invite everyone to enjoy the dinner prepared for us tonight. Let this be a time to connect, celebrate, and savor the company of our fellow colleagues.
For the dinner, may I direct you to the right side or actually left side ninyo ng venue for our buffet. For our VIPs, you don't have to go to the buffet table. Dinner will be served sa inyo. Just stay where you are. I would also
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and the VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinumed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli Biocare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinumed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Intinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli Biocare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Intinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Job Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinumed and the VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Job Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and the vet scan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli Biocare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and the vet scan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey. Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat.
request everyone to rise for the entrance of our honored guests.
Please welcome the processional, led by the PCCP Specialty Board, Dr. Criselda Lau, Dr. Cesar Bernardino. PRC officers, Dr. Claro N. Mingala, Chair of PRC Board, Dr. Tom Acorda, PRC Board Member. PVMA officers, Dr. Jerry Alcantara, Dr. Lina Policarpio. PVMA Council, Dr. Mary Grace Bustamante. PCCP Conferment. PCCP Diplomates. PCCP Fellows. PCCP Board of Directors, Dr. Paul Cardeño, Dr. May Christine Espiritu, Dr. Ken Anthony Lau, and Dr. Rochelle Alonte. PCCP Officers, Auditor, Dr. Sherlyn Subiaga-De Lima, PRO, Dr. Gino Jeffrey Bailon, Treasurer, Mary Ann Navales Mirasol, Secretary, Eugene Lacbao Gomco, Vice President, Dr. Randy Galutan, President, Dr. Geoffrey Marl Carullo.
Let us remain standing for the prayer and the singing of the national anthem, followed by the Himno Veterinary.
Panginoong Diyos, pinagpupurihan at sinasamba ka namin. Ang iyong mga gawa ay tunay na dakila. Ang iyong mga pagpapala ay hindi nauubos. Ang pagmamahal mo ay araw-araw namin nararanasan. Salamat sa araw na ito na kami ay muli mong tinipon upang magkaisa at matuto mula sa isa't isa. Tulungan mo po kami na ituon ang aming atensyon sa mga mahalagang bagay na mapag-uusapan sa araw na ito. Buksan mo po ang aming pangunawa at ang aming pandinig upang lubos po namin maintindihan ang mga mapag-uusapan sa araw na ito. Ikaw nawa ang maging sentro sa aming pagpupulong na ito. Sa inyo po namin inaalay ang katagumpayan ng pulong na ito. Sa pangalan ni Jesus. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, telos ng sinakanan, alam ng puso, sa titik mo'y buhay. Upang hinirang, tuyag ka ng magiting, sa mandulupin, di ka pasisingil, sa nagatang tutok sa simoy at sa langit kong pagaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na naghihingi, ang bituin at araw niya kailan pa may di matitingin. Luman ang araw ng buwan, ating pagsinta, buhay langit sa piling mo. Aming ligaya na pagkay mag-aami, ang mamatay ng dahil sa'yo. madlang veterinaryo, loobin ay makadiyos makatao, marunong magilas matatag sa paglago ng propesyon sa bayan at sa mundo. Mahal ko ang Pilipinas, tungo sa kanyang pagunlad hanggang wakas. Mahal na mahal ko ang lahing Pilipino, pagbabago sa bansa'y matatamo. Tayo ay nagpulong-muli at nagkakaisa upang talakayin ang suliranin sa pagtataguyod ng kalusugan, mga alagang hayop sa bakuran kanayunan. Mahal ko ang Pilipinas, tungo sa kanyang pagunlad hanggang wakas. Mahal na mahal ko ang lahing Pilipino, pagunlad sa propesyon matatamo, pagunlad sa propesyon matatamo, pagunlad sa propesyon matatamo.
Thank you, everyone. You may now take your seats. To officially open tonight's program, please welcome the President of the Philippine College of Canine Practitioners, Dr. Geoffrey Marl Carulo.
Good evening, everyone. First of all, I would like to acknowledge the presence of the following. The Chairman of the Specialty Board of the Philippine College of Canine Practitioners, in behalf of Dr. Adrian Ibanez, Dr. Cesar Bernardino, the PVMA Council for on the Specialty College Chairman, Dr. Mary Grace Bustamante, from the PRC Board, Dr. Tomas Acorda, and of course, the Chairman, Dr. Claro Mingala. The incoming PVMA President for 2026, the beautiful Dr. Lina Policarpio, and also part of the Specialty Board, Dr. Chris Lau. Also, the immediate past president siya of PCCP, Dr. Oscar Macenas. May nakalimutan pa ba ako? Wala na ata. So, welcome to the PCCP first ever conferment under my presidency. Hindi ako nakapag-prepare ng message para dito sa particular na conferment na to. Pero ang masasabi ko lang, lalo na sa mga vets na 5 to 10 years na of practice, siguro it's high time for you na pumasok na sa PCCP. Kasi sa PCCP, madami kayong matututunan, gaganda yung connections nyo sa kapwa nyo veterinaryo. And of course, ang pinaka-importante sa lahat, PCCP is an inclusive organization. And when I say inclusive, lahat ng gusto ng dog and cat practice, welcome na welcome po kayo lahat
sa PCCP. So, hindi ko na kukunin yung time na to kasi madami pang magsasalita. Pero in behalf of the college, we would like to congratulate the newest conferred diplomates and fellows of PCCP. Again, maraming salamat. And bago ko makalimutan, maraming salamat kay AOZI for the sponsorship. Thank you.
Thank you so much, Dr. Job. And now, to grace us with a background of conferment and presentation of new fellows and diplomates, may we call on the PCCP Specialty Board member, Dr. Criselda C. Lau.
Good evening. The Philippine College of Canine Practitioners was formally organized in April 7, 1988 at the Manila Peninsula Hotel in Makati, Metro Manila, and was registered with the Securities and Exchange Commission of the Republic of the Philippines in June 25, 1989. The installation, conferment, and induction ceremonies were installed by Dr. Romeo F. Buencamino, Chairman of the Board of Veterinary Medicine, while the titles of Fellow and Diplomate were conferred by the Commissioner of the Professional Regulation Commission, Julio B. Francia, Jr. The officers of the college and the members of the Specialty Board of Canine Medicine were similarly inducted by the Commissioner. Since then, PCCP has conducted several conferment ceremonies. The conferment ceremony is a solemn ceremony whereby a distinguished professional is recognized for his or her expertise and achievements, having been able to comply with at least the minimum requirements. This ceremony emphasizes the high value of lifelong learning and the continued excellence of distinguished practitioners in the practice of veterinary medicine. It is by this ceremony that the PCCP formally confers the distinguished status as diplomate or fellow in canine practice. As a diplomate, the conferee is proudly introduced to the PCCP family and the public as a regular member. As a fellow, a conferee status as among the proud and seasoned pillars and mentors of PCCP is established. The fellow is automatically inducted as a member of the Council of Elders. For 37 years, the PCCP has been unwavering in its mission to elevate small animal practice, championing growth, excellence, and specialization in veterinary medicine. Tonight's conferment of new diplomates and fellows stands as a proud testament to that enduring commitment. Tonight's conferment is a celebration of progress, passion, and the shared pursuit of veterinary distinction. I have the honor to present to you the 3 candidates for the fellow status of the Philippine College of Canine Practitioners. The candidates are as follows: Dr. Blanche B. Bolo,
Dr. Blanche Bolo completed her pre-veterinary studies at UP Diliman and earned her Doctor of Veterinary Medicine degree from UP Los Baños in 1989. She passed the veterinary licensure exam in 1990 and began her practice shortly after, focusing on canine and feline medicine. She was conferred as a diplomate of the Philippine College of Canine Practitioners on October 16, 2009. Dr. Bolo also served as auditor and secretary of the Philippine Animal Hospital Association from 2008 to 2012. Throughout her career, she has been dedicated to advancing veterinary practices and improving animal welfare in the Philippines. Her contributions have significantly influenced the standards of veterinary medicine in the region.
Dr. Ernesto R. Lumibao.
Dr. Ernesto Lumibao, a graduate of the Central Luzon State University with a Doctor of Veterinary Science Medicine degree, has a distinguished career in veterinary medicine, education, and community service. He served as a faculty member of CLSU, worked as a school veterinarian at Bataan Peninsula State University, and gained hands-on experience with exotic wildlife at Zubik Safari. Conferred as a diplomate in 2006, he is the proprietor of Pet Needs Veterinary Care and Grooming Center, which he has successfully operated for over 30 years. Dr. Lumibao also held leadership roles including PAHA, Vice President, Rotary Club President, and current Director of the Philippine Chamber of Commerce and Industry, Bataan Chapter. His dedication to professional excellence and community development makes him a highly respected figure in both veterinary and local business circles. Dr. Ernesto R. Lumibao.
Dr. Alex R. Martinez.
Dr. Alex R. Martinez, a pioneer in companion animal practice since 1980 and among the first batch of PCCP Diplomates in 1989. He is the founder of the Martinez Veterinary Clinic in Quezon City and was honored as the most outstanding veterinarian in companion animal practice by the BPOP in 1985. He also served as a president of PAHA in the same year. Dr. Alex R. Martinez. Thank you so much, Dr. Lau. May we now call on the Chair of the PRC Board of Veterinary Medicine, Dr. Claro N. Mingala, for the formal conferment of the Fellow recognition.
preparation for actual conferment for their diplomate, for their fellowship status.
Having qualified all the necessary requirements, by the authority vested in me, I am now officially conferred a fellow recognition to the conferees joining here in front. With this status, the practitioner shall be accorded all the rights and privileges appertaining thereto, including the use of the title when appropriate. My congratulations to the new fellows of PCCP.
Congratulations to our new fellows. Kindly remain on stage to accept the prestigious Dr. Enrique T. Carlos Award. Let me read the citation. The Philippine College of Canine Practitioners Conferment, in recognition of exemplar performance, commitment to professional excellence and fulfillment of the standards set forth by the Philippine College of Canine Practitioners, is hereby conferred the title of Fellow. Dr. Blanche Bolo.
With the same citation, this Dr. Enrique T. Carlos Award is also given to Dr. Ernesto R. Lumibao and Dr. Alex R. Martinez.
Again, congratulations to our newly conferred fellows. Let us now hear an inspirational message from the President-elect of the PVMA, Dr. Lina Policarpio.
The distinguished officers of the Philippine College of Canine Practitioners, led by our dynamic and ever-energetic President, Dr. Joff Carulio, na lagi akong kinukulit. But good evening, everyone. Side comment lang, kanina ayoko magpa-makeup, magpaayos. But when I saw the beautiful ladies of PCCP, sabi ko, bigla ako na-insecure. Nagpaayos na rin ako. Ayon, side ano lang. Again, on behalf of the Philippine Veterinary Medical Association, I extend our heartfelt congratulations to the newly conferred fellows of the PCCP. This significant achievement marks not only personal excellence, but also reflects the collective spirit of mentorship, dedication, and passion that defines the veterinary profession. Holding the title of fellow is more than adding letters after one's name. It is a renewed commitment to uphold the highest standards of care, ethics, and service, and may it inspire each of you to take on leadership roles, strengthen bonds with your colleagues, and elevate the profession through collaborative action and shared wisdom. As we all know, our profession is not without its challenges, many of which you've encountered in your own practices. But in facing these, let us always by ethical behavior, professional integrity, and the spirit of unity that binds us all. At PVMA, we believe the challenges facing our profession are best met hand in hand with unity and cooperation. Through collaboration across associations, specialties, and generations, tama ba, Dr. Macenas? Across generations talaga dapat ito ngayon, ano? We shape a future where veterinary care continues to thrive. Together, we are not just advancing veterinary medicine, we are building a lasting legacy of compassion, expertise, and collaboration. Once again, congratulations to the newly conferred fellows. Mabuhay ang Veterinaryong Pilipino, mabuhay ang PCCP, mabuhay ang PVMA. Magandang gabi po sa inyo lahat.
Give us this short message from our partner company, Please help us welcome on stage Miss Judith Q. Cabigan Domingo.
First and foremost, AOZI Philippines would like to express our deepest appreciation to Dr. Sherlyn Subiaga-De Lima for her comprehensive presentation entitled 8 Urinary Issues Every Veterinarian Should Recognize in Companion Animals. Your in-depth lecture will aid the practice of every Filipino veterinarian in our country. Moreover, our greatest appreciation goes to each and every one of you who attended the program. Your active presence, despite of the inclement weather, made this event possible and successful. Further, we would like to extend our deepest gratitude to the Philippine College of Canine Practitioners, Dr. Jeffrey Carullo, the President, its officers, the board, and Diplomates. We are very grateful to you. We would also like to acknowledge the efforts made by different teams and committees for making this event come to fulfillment. We hope that the knowledge that we have gained will be useful in our continuing education and endeavor. We at AOZI are looking forward to be your partner with your journey as companion animal practitioners. Let's go hand in hand together to minister to our four-legged community by providing quality nutrition to reduce the risk of non-communicable diseases. As we continue to explore and to develop veterinary products that would support your practice, we highly appreciate all your efforts to disseminate proper nutrition, managing conditions, and preventing diseases. May we continue to be in partners that will improve the health and longevity of companion animals. We keenly anticipate a prolific partnership with you. Once again, congratulations and thank you for supporting Philippine College of Canine Practitioners and AOZI Philippines. Good evening.
Thank you so much, Miss Judith, and thank you so much, AOZI. We now move to another highlight of the evening, the introduction and conferment of our new diplomate candidates.
To introduce the candidates, let us all on Dr. Cesar Bernardino, member of the Specialty Board of the PCCP.
Good evening, ladies and gentlemen. Good evening, distinguished guests. Also to our President, Carullo. I have the honor to present to you 5 candidates for the diplomate status of the Philippine College of Canine Practitioners. The candidates are as follows: Dr. Elfren Fernandez Celestino Jr.
Dr. Elfren F. Celestino Jr., a distinguished veterinarian, researcher, and academician. He is the head of the Department of Veterinary Clinical Sciences at CLSU and an attending veterinarian at the Veterinary Teaching Hospital, a cum laude graduate and awardee of the Most Outstanding Veterinary Student. He earned his master's from UP Los Baños and PhD from North Dakota State University. Recently, he was conferred diplomate status in small animal surgery by the Philippine College of Veterinary Surgeons. Dr. Efren F. Celestino Jr.
We call on Dr. Olivia Francisco Inocencio.
Dr. Olivia F. Inocencio is a veterinarian with degrees from Central Luzon State University. She founded her own practice in 2000, trained in Japan, and specializes in surgery, emergency care, and dermatology. Recently, she pursued cardiology training in Thailand. She is active in several veterinary groups, rescue pets, and is passionate about helping others. Dr. Olivia Francisco Inocencio.
Now, I give it to you, Dr. Manuel Paulo Granadosin Jr.
Dr. Manuel Paulo Granaduzin Jr. is a faculty-ranked associate professor, one of De La Salle Araneta University, and the administrator and practice manager at the Veterinary Teaching Hospital and Laboratory Animal Facility. He is currently conferred as Diplomate of the Philippine College of Veterinary Surgeon Companion Animal, and he is currently serving as one of the board of directors. He also chair of the University Institutional Animal Care and Use Committee and is currently a veterinarian consultant for canine clinical trials and consultancy in animal products and nutrition. Most recently, he was appointed as a member of the Regional PNP Explosive Ordnance Disposal and Canine Unit NCR Advisory Group for Police Transformation and Development, Dr. Manuel Paulo Granaduzin Jr.
Our next doctor would be Dr. Harold Val G. Hernando.
Dr. Hernando, a 2017 graduate of Isabela State University School of Veterinary Medicine, specializes in small animal practice with a keen focus on feline medicine. His experience spans Metro Manila, Singapore, and international training, enriching his expertise in veterinary medicine. He served as Chief Veterinarian and Medical Director of the Cat Clinic Philippines from 2021 to 2023. Driven by his love for feline companions, an associate member of the Philippine College of Veterinary Surgeons Companion Animal, he is also a pioneer in performing laparoscopic surgeries in the Philippines. Currently, he is a senior veterinarian at Peralta Veterinary Center in Parañaque, specializing in minimally invasive procedures, soft tissue, and reconstructive surgeries. Dr. Harold Val G. Hernando.
And the last but not the least, we call her now Dr. Reina A. Mutia Cardenio.
Dr. Reina Mutia Cardenio earned her Doctor of Veterinary Medicine degree from Central Luzon State University in 2016 and passed the veterinary licensure exam in the same year. She has been practicing small animal medicine since 2016, working with various clinics in Nueva Ecija and Caloocan. In 2019, she broadened her expertise by working as a veterinary technician in Singapore until 2020. Upon returning to the Philippines, Dr. Mucha Cardenio and her husband established their own veterinary clinics in Malolos and Plaridel, Bulacan. She continues to serve as the senior veterinarian, providing compassionate and professional care to her clients and their beloved pets. Her fields of interest include preventive medicine, dentistry, exotic animal medicine, and anesthesia, reflecting her dedication to advancing animal health and well-being. Dr. Reina A. Mutia Cardenio.
May we ask the diplomate candidates to stay in front of the stage? For the diplomate candidates hooding ceremony, may we call on their mentors, Dr. Marianne, Doc Paul, Dr. Chris, Dr. Randy, and Doc Joff. The concluding ceremony is the first step for PCCP diplomate status, and it is conferred with the candidates who have successfully fulfilled the requirements for PCCP diplomate. To confirm the conferment of the new diplomates, may we call on Dr. Mary Grace Bustamante, PVMA Council on Specialty College Chairman.
Having qualified all the necessary requirements by the authority vested in me by the Council on Specialty Colleges, I would like to officially confer the diplomate recognition to the conferees joining here in front. With this status, the practitioner shall be accorded all the rights and privileges appertaining thereto, including the use of the title when appropriate. My congratulations to the new diplomates of the Philippine College of Canine Practitioners.
Thank you so much, Dr. Bustamante. Congratulations to our new diplomates. Please remain in front to accept the prestigious Dr. Enrique T. Carlos Award as the inaugural group of diplomates. Allow me to read the citation. Philippine College of Canine Practitioners Conferment in recognition of exemplary performance, commitment to professional excellence, and fulfillment of the standards set by the Philippine College of Canine Practitioners. Dr. Efren Celestino is hereby conferred the title of Diplomate of the Philippine College of Canine Practitioners, bearing the honor of the Dr. Enrique T. Carlos Award given this 28th day of July 2025 at Luxent Hotel, Quezon City. Signed, Dr. Adrian P. Ibanez, Chairman Specialty Board, and Dr. Geoffrey Marl B. Carullo, President.
With the same citation, this Dr. Enrique T. Carlos Award is also given to Dr. Olivia Inocencio, Dr. Harold Bal Hernando, Dr. Manuel P. Granadozin, and Dr. Reina Mutia Cardenio.
Congratulations to all our diplomates. Dr. Enrique T. Carlos awardees. You may take your seat. Thank you so much.
At this point, may we call on the new fellows and diplomates to be gathered here on stage or in front of the stage for the charging. To officiate the oath of a graduate specialist, we call on our PRC board member, Dr. Tomas Acorda.
Taas po natin ang ating kanang kamay. With conviction, recite natin ang ating oath of a graduate specialist of the Philippine College of Canine Practitioners. Again, with conviction. I state your full name. Ulitin natin. With conviction. Kailangan rinig hanggang Makati at hanggang Caloocan, hanggang Bulacan. Ulitin. I state your name. Having completed this prescribed qualifications set forth by the Philippine College of Canine Practitioners, do solemnly swear before God and this honorable assembly that I will uphold the highest standards of veterinary medicine with unwavering dedication to the health and welfare of my patients. I will remain steadfast in the pursuit of excellence, committed to evidence-based practice, continuing education and ethical conduct. I pledge to serve with compassion, integrity, and respect toward everyone, especially my fellow professionals. I will support the mission and vision of the college, promote collaboration within the veterinary community, and uphold the prestige and honor of the specialty I now represent. With humility and gratitude, I accept the responsibilities entrusted to me as a fellow or diplomate. Of the Philippine College of Canine Practitioners. So help me God. Again, congratulations, fellows, new fellows and diplomats. At sabi ni Dr. Joe, magbayad na raw kayo ng inyong membership dues.
Thank you so much, Dr. Tom Acorda. Bayad na daw po sila. Our heartfelt congratulations to our newly conferred fellows and diplomates.
Congratulations to our fellows and diplomates, newly conferred, newly minted. The next portion of this evening is the awarding of plaques of recognition, to be led by yours truly, Dr. Gino Bailon, together with Dr. May Christine Ablaneda Espiritu. This Philippine College of Canine Practitioners is hereby awarded the plaque of recognition to Dr. Lina Policarpio
And Dr. Jerry Alcantara, to be received by Dr. Lina Policarpio.
Let me read the citation. The Philippine College of Canine Practitioners is hereby awarded the plaque of recognition to Dr. Lina Policarpio in grateful appreciation of your unwavering support and valuable contributions to the Philippine College of Canine Practitioner given this 28th day of July 2025 during the PCCP Conferment ceremony at Luxent Hotel, Quezon City. Signed, Dr. Joffrey Maral B. Carullo, President of the PCCP.
Same plaque of recognition is also awarded to Dr. Thomas Acorda.
The same plaque of recognition is given to Dr. Claro N. Mingala.
Same recognition is also awarded to Dr. Mary Grace Bustamante.
At this point, we would like to call on Dr. Bingala. Can we ask you for a few short words, Doc?
Bigla akong nagulat. Anyway, thank you very much for inviting us in these very momentous occasions. The conferment ceremonies for Diplomates and Fellows of the Philippine College of Canine Practitioners. I would like also to take this opportunity to encourage the PCCP to please apply for the accreditation at the Philippine Professional Regulations Commission with regards to the CPSP CATS accreditation program. I know that even without the PRC or even without the PCSP, the Philippine Veterinary Medical Association is already recognizing all the colleges, specialty colleges across specialties in the veterinary profession. Pero sabi nga, pag in-accredit ng PRC under the CPSP ang ating specialty colleges, it's another parang icing on the cake na lang. Parang isang opisina na pag ikaw ay may office, wala namang bumabawal sa'yo. But if you apply for the ISO, that's another milestone with regards to your office or with regards to the specialty colleges. So, as the chairman of the PRB or the Professional Regulatory Board for Veterinary Medicine under the PRC, I encourage you to start applying. Sabi nga, nag-uusap kami kanina ni President, si President na they will be visiting the PRC to acquire more information with regards to the CPSP. And we are welcoming that so that we will all be informed about this program under the PRC. So again, thank you very much and congratulations again to the new Diplomates and Fellows of the PCC.
Thank you so much, Doc. At this point, we would like to continue the awarding of the plaques of recognition. With the same plaque of recognition, we would like to call on the members of the PCCP Board of Directors in recognition for their grateful, unwavering support and valuable contributions to the Philippine College of Canine Practitioners. The PCCP would like to bestow this honor to Dr. Paul A. Cardenio.
Same recognition is also awarded to Dr. Ken Anthony L. Lau.
With the same plaque of recognition, this is awarded to Dr. Christine Ablaneda Espiritu. Special award from the Philippine College of Veterinary Surgeons, Companion Animal. The Philippine College of Veterinary Surgeons, Companion Animal. Its Golden Scalpel Award is hereby given to Dr. John Michael T. Figura. First Veterinary Surgery Masterclass 2025. May we call on the President of the PCBS, Dr. Paul Cardenio, to award the Golden Scalpel Award.
Same flag of recognition to Dr. Gino Jeffrey T. Bailon. Dr. Gino is our PRO. Dr. Sherlyn Subiaga-De Lima, our auditor.
Same plaque of recognition is given to Dr. Mary Ann Novales Mirasol, PCCP Treasurer.
Same flag of recognition is awarded to Dr. Eugene L. Gomo, our very diligent secretary.
At this point, we would like to call on the PCCP Vice President, Dr. Randy Galutan, to receive the same citation. Can we request Dr. Randy to stay to award the same site of recognition to Dr. Geoffrey Carulo, PCCP President.
As we close this special night of celebration, reflection, and academic excellence, we call on Dr. John Michael T. Figura, owner of the Clinica Veterinaria de Figura Animal Hospital.
Good evening, everyone. On behalf of the Philippine College of Canine Practitioner, I would like to extend a heartfelt gratitude first and foremost to the Grand Architect of the Universe for blessing us with the success tonight's event. To our esteemed guests, dedicated diplomates, and fellow or proud fellows, thank you for being part of this meaningful occasion. Congratulations to our newly conferred diplomates and fellow. Your hard work, commitment, and passion for veterinary excellence inspired us all. Special thanks to Mr. or Sir Dave Chua of AOZI and to our dearest President, Dr. Carullo, for their unwavering support and valuable contribution in making this conferment ceremony success. Before we officially conclude, I am pleased to share two important announcements. On August 18, 2025,
will be holding a face-to-face seminar on harnessing artificial intelligence in veterinary medicine at Novotel. This is promising opportunity to explore the future of our field. Everyone will receive an email with details and registration link very soon. Secondly and finally, we're proud to announce our biggest academic gathering yet, first postgraduate scientific conference of the Philippine College of Canine Practitioners, happening on October 28, 29, and 30, 2025. This landmark event is proudly supported by our major sustaining partners, Zoetis, Vetmate, and AVLI. Please stay tuned to our official Facebook page for updates. Do take note, I repeat, do take note, all conference registration ticket has already been sold. So, please secure them to our sustaining members. With that, thank you once again for your presence, your commitment, and your continued support to the advancement of veterinary medicine in the Philippines. Have a great evening, and may we all continue to serve with passion, purpose, and pride. Mabuhay ang veterinaryong Pilipino.
Before we officially conclude, may we request everyone to join us on, the members of the PCCP and the newly conferred diplomates and fellows for a picture taking on the stage. Hello. On behalf of the Philippine College of Canine Practitioners, we thank you for joining us tonight and celebrating this milestone with our new diplomates and fellows.
May this evening inspire us all to continue striving for excellence, for the profession, and for the welfare of every animal we serve.
Good night and congratulations, everyone.
So come up with me, run up, jump. Watch me running up the place. I'm already starting and my girls are on the way. Watch me upping up the place. Wanna see you bumping, baby, bouncing to the bass. Are you not entertained? I ain't gotta explain. I'm with all of my sisters, got him going insane, yeah. You know we on a mission, all gas, no brakes, yeah. Breaking out of this system, breaking out of this cage, yeah. Bet you're getting up, ain't that enough? 순간 있지만 누가 누군지, think you're running out, just be gonna walk it, talk it. 눈 감고 하나, 둘, 셋. So come on with me, I'll take you high. That prima donna spice up your life. You know I got that shit that you like. So come up with me, run up, jump. Watch me running up the place. I'm already starting and my girls are on the way. Watch me open up the place. Wanna see you bumping, baby, bouncing to the bass. Black pink in your area. Type of girl that'll make you wanna dream. Type of girl that comes straight up off the screen. Type of girl you wanna ice and make me freeze. Type of girl you wanna wake up in the pre. I bring money to the table, not your dinner. Both my body and my bank account could figure. Thinking about me, but there's nothing to consider. If I let you in my circle, you a winner. Didn't know that you were cold till you found my fire. Heaven's gate just open up here and quiet. If you say something else, you're a liar. Cause I'm that girl that drive you crazy, but you can't leave me alone. Got you thinking maybe I was supernatural. Put you under spells or look into a crystal ball. I'm not like just other girls at all. I'm the type of girl that make you forget that you got a type. Type that make you love me when the only thing you done is like. I'm the type of girl, I'm the type of girl. I'm the type of girl, I'm the type of girl. Like da-da-dum, da-da-da-dum. Like da-da-dum, da-da-da-dum. I'm the type of girl that everybody type, that would tap, tap, tap what everybody like. You can check my steps, got everybody's side, and I run them laps round everybody's mind. All of these girls on my bucket shit, that mean they all cap. Being the best at whatever I do, that's something on brand. Type of girl that you wish for when you blow that candle out. Type of girl that you wanna take back to your mama house. Type of girl that don't ask for what she wants, you taking out. Type of girl who got gag and some quality of Chanel. Now you know that you were cold cause you fit my fire. Heaven's gate just opened up here and quiet. If you say something else, you a liar. Cause I'm that girl that drive you crazy, but you're killing me alone.